Thank you, Dr. Yogesh, for this nice introduction and opportunity to talk in this instruction course. I think I would set the tone for today's instruction course because there are going to be interesting topics which will follow by Dr. Debashish and others. So I think starting and expanding a practice. So starting a practice itself is how many of the ophthalmologists who have completed recently are thinking of starting a practice. There is a huge question mark. So because starting a practice is too challenging these days. It's not like the olden days when we start a practice with a small investment, but these days the ophthalmologists are facing a huge challenge, and there are too many questions in the mind of an young ophthalmologist about starting the practice. And the topic given to me is on the 3 P's, like place, purchase, and publicity. I would also cover on what are the common questions which an young ophthalmologist may have, and then talk about this topic. The first question which any young ophthalmologist will have is, when should I start? Should I get, after my PG, should I start right away, or should I get trained, or should I do a fellowship, or should I be working with somebody to start before I gain the knowledge and everything? I think the right time to start is now, as soon as you finish, because as you all know, this MBBS and PG and this fellowship, all this education itself takes a huge time, like at least 13 years of our life. And if you are somebody who thinks, who wants to do a private practice, I think the right time to start is now. With a decent surgical skill, because I think phaco you have to learn, and one thing before you start is maybe you have to learn the nuances of the private practice. So before you start, maybe you work with a private practitioner, a corporate hospital, or a private practitioner to know what is a private practice, and then you start. So basic education, the MS ophthalmology or your fellowship, and then confidence in doing those basic surgeries, at least like phaco and all those things. And then more important is the confidence to do a private practice, because there are lots of nuances. Starting a private practice is not that simple. You have to learn how to convince a patient, learn how to do some HR management. So that experience you will gain working in a corporate hospital or with a private practitioner. I think you should learn that for say 1 year, and then that's the right time to start. Mostly we were having a discussion with Dr. Debashish also, like most of the time the doctors start at say 35 to 38, 39. That's the time when many of the practitioners start the practice. But I think as soon as you're ready, you should start. So the next common question is, should I start a full-time practice or a part-time practice? Can I work somewhere in the morning and then can I do a practice in the evening? But because now these corporate hospitals, they have set a very good standard for an eye hospital, and the patient comes to the hospital with an expectation. So I feel a full-time practice is viewed more seriously by the patient than a part-time practice. So it's always better to start a full-time practice. I do agree that there are challenges of finances and monthly survival income and all those things, but definitely a full-time practitioner is seen as a more serious practitioner than a part-time practitioner. So maybe once you have this enough experience, it's better to always be a full-time practitioner. Initially, it will be demanding. You don't have too many patients, too many surgeries happening, but as you go ahead, I think full-time practice is going to be more fruitful. And the other common question is, should I start small? Can I start a small clinic and then can I expand it into a hospital? But now a patient who wants to have a cataract surgery or a basic procedure comes with the expectation of an eye hospital. He knows that an eye hospital will have a reception with so many staff with uniforms, and then you have those ambience and OT and at least basic facilities available. So basically starting as a small clinic and then expanding into an eye hospital may not work these days. So at least a very decent 2,000, 3,000 square feet setup with the OT is what is recommended if you're looking at a long time serious private practice. And again, I understand that there are challenges in financing and all those things, but gone are those days when you start a small clinic and then expand it. I would suggest that look at a decent sized hospital when you are going to start. And how much do I need? I think that's the big question which we have in private practice. So I think to start this kind of a practice with your own OT and 3,000 square feet space, at least investment of 70 lakhs to 1 crore is what is required. But definitely it's going to be fruitful. I'm sure it's going to get back the money which you've invested if you identify the right place and start the practice. So though it might look huge and maybe the individual practitioner doesn't want to take that risk initially, but definitely if you have the right place, I think this budget you can recover it at no time. So the next question will be, where will I get the money? So all of us are not born rich to invest that 70 lakhs or 1 crore. So maybe if we have that, it's good. The next common source of funding is our family and friends. So maybe you try to get that money from the family or friend. A bank loan is a good option if you can give a collateral. Now, lots of banks are offering loans even without collaterals. Getting an investor is a good idea, but basically, I would say in your initial stages, an investor may not have the same potential and appetite as you. So basically, having a non-ophthalmologist investor might not be an advisable thing. More focus is now going towards a group practice. Rather than starting as a single practitioner, maybe if 3 of the juniors can join together and start a group practice, I think there is nothing like that. And the financial commitment is also less when you start a group practice. So better to go as a group. I think this is where you can get the money for your practice. The next question is whether I should start in a city or a town or a village. I think now the potentials are in the towns. So cities are already populated. There are so many competition from ophthalmologists, corporate hospitals, charitable hospitals. Better to go to smaller towns. I think there is a huge opportunity now in the tier 2 kind of towns, not in the tier 1 towns, but tier 2 towns. People are spending power. I also learned that from the equipment companies that most of the ophthalmologists to purchase these larger equipments are now coming from the smaller towns and tier 2 kind of towns. It's not the ophthalmologists in the city who are buying those expensive equipment, meaning there is a huge revenue potential in the smaller towns. So identify those towns which are closer to you and then start your practice. And I think more everything is about the location. So where do you start your practice? So maybe, as I said, do it in a place where the competition is less and people don't have any other option for eye care. The population demographics, you can actually understand that where to start is basically from these big retailers like Reliance, Trends, or all those big jewelry chains. Open up shop in a particular tier 2 town. I think they do enough market research for you. So that is the place where you should start. So you don't have to spend money on the market research, and identify the traffic patterns in that particular location. If that is accessible to you, to the patients, it's near the bus stand, all those things, whether it's near the railway station, you have to identify a location which is that way. And paying capacity, are there any industries where people get employment in those localities, or there are rich farming communities? You start your practice in those kind of places, and whether you can put up good signages, because initially most of the patients are going to be walk-ins, and all these factors I think you have to consider for the location. And another thing is, what all should I purchase? Because there are so many instruments available. I think initially you should go for the basic instrumentation. Don't have to buy an OCT at the start of your practice. So once you attain that potential to reach a particular number of patients, that is when you start expanding. But ophthalmology practice cannot be done minimally. Also, you need at least the basic instruments like the autorefractor, good quality slit lamps, reasonable surgical microscope, phaco machine, all those things. And you start with them. Another option is to buy them in bulk purchase, or you can buy them as a group, or you can even look at second-hand instruments to start off with. So the final slide is, how do I get those patients? I think Dr. Yogesh should be talking in more detail about that. But initially, as a small practitioner, I think you should focus more on public relationship. You should understand what is the difference between advertising and public relations. So public relation is all those things. Advertising is you go and tell the patient, I'm the best, you come to me. That's not the way, because in healthcare, advertising doesn't work because patient gets suspicious. So what you have to do is focus more on the PR skills, more on public relation, do some community activities, maybe eye screening camps, awareness programs. Let the local media write about your hospital. If you have treated a particular patient who has got a special condition, those are the activities. Be part of those Lions Club and organizations. Talk to people. I think become a local celebrity. That is what would create all those public relations activities for you. I think my time is up, and thank you. And if you are really interested about the practice development, you can get into our website, and these are my contact information if you want to have any other questions with me.
Thank you,
Thank you, sir.
Senthil.
Yeah.
Thank you very much, Senthil.